Hello and welcome to episode 4. As you may have noticed, the background around me has changed, and the reason for this is because I've returned back to the UK. So there's quite a gap between episode 3 and episode 4, and this is mainly because I've put the vlog to the side a bit as during my last few weeks in South Africa. In this episode, I want to talk a bit about the quirks of Bara, and what I mean by this is sort of the things that really struck me and stayed with me about the experience, and they tended to be little things actually, not big things, but small things about how medicine differed, and it's mainly to do around equipment and things that were very different from what I was used to from back in the UK. And part of that is obviously due to the resource limitations that they do have here. But also part of it is just a different way of doing things, and so it's just trying to adapt to that. So I'll talk a bit about what the things I found when I first started that surprised me a bit. Also talk about needlesticks, because I know that's quite a big thing. And then finally I'll finish off by talking about what I think is important to bring to Bara, given the quirks and some of the equipment that they don't quite have here. So hopefully you find it useful. This footage is taken from a local nature reserve near where I lived in Johannesburg called Riversburg. It was a really nice place to hike, and you got great views of Johannesburg, and you also saw zebra, which is pretty cool. So let's talk a bit about what it's like at Bara. So first of all, I think I'll talk about the equipment, and I'll tell you a story about the first day when I was in Bara. And the first thing I was asked to do was to suture a eyelid laceration. And I was really keen because this is what I came for. I came because everyone told me you can come here and do lots of practical skills such as suturing. And so I was already excited for doing this. And then I went through the process of finding all the stuff. And what you'll notice at Bara is that everything is not where it should be, and everything's not quite organised how you would expect it to be. You often spend 30 minutes before suturing looking for all the kit that you need, and all the different equipment that you need, which is really, really frustrating most of the time. So I got all my stuff together, and then I noticed first off that the suture kit itself was one pair of non-tooth forceps and one pair of needle holder. There are no scissors in there. So I asked, what do I do if I don't have any scissors in the pack? And the solution is that they just use a scalpel blade to cut most things here instead of scissors. But you don't get a scalpel holder, you just use the blade. So that was the first thing. Then on top of that, when I looked for sutures, I realised that at the time the only available sutures were either 1/0 or 6/0, and there was nothing in between. And this is pretty much always the case for any laceration, is that you won't have a full selection of sutures, and you very often have to make do with what they have available, which oftentimes is either a needle big enough to catch a shark, or a needle so small that you really struggle to see the thread. And so you can already see the propensity for getting into trouble, especially with needle sticks, is really high because of all of these factors. A quick aside so we can quickly talk about needle sticks, because I know it's a big topic that worries a lot of people, myself included, when they're thinking about coming to places like South Africa where there's a high incidence of bloodborne viruses. I think generally it is still quite a rare thing to happen. I think very few elective students do get proper needle sticks when they need to go on to Ep.4 for it. But it's not uncommon either, and it does happen. And during my time at Bara, there were 3 students who I knew of who went on PEP as a result of needle sticks. And I think what I need to say about this is that generally it happens because you're tired and because you're not focusing, and also because of a few things that conspire against you, like the aforementioned suturing. But the other things I need to tell you about are things such as the cannulas. So for people who aren't from the UK and call them IV lines, the cannulas here, they don't have needle guards. So when you have the cannula in and you pull the needle out, there's no guard there to protect from the sharp. So you have to be really careful with cannulas when you put them in. Because there are no guards on the cannulas, people tend to throw the needles onto the floor when they've got a cannula in. And oftentimes people forget about these, and so you can also get a lot of sharps on the floor, and you can also get a lot of sharps around sharps bins. And so you have to be really focused as to where you're walking, where you're putting your hands, because there could always be a sharp somewhere and you just don't know about it. And then the third thing really that I can really think of is that you often get drunk or uncooperative patients, because that's the nature of trauma at Bara, and these patients can make situations very, very risky for getting needle sticks, because as soon as you put a needle in, they're moving everywhere. And so I'd say these are the three main things on top of the suturing that lead to a higher propensity for getting needle sticks. But as always, as long as you're focused, as long as you're concentrating, as long as you're extra careful, you'll be fine. So my shorter side ended up being quite long, so I ran out my footage, but so it's back to me talking to a camera, unfortunately. But I think I'll try and wrap up this video quickly and just talk briefly about what's equipment I think is essential to bring, and what equipment I think is optional but is good to bring. Because it's very useful, and it's something that I wasn't fully aware of before I came, about all the things that I may or may not need, and I think it's quite useful to know about. So first of all, absolutely the most essential thing to bring are goggles, and it's because obviously there's a high risk of splash injuries here, and you just don't want to take any chances. Second thing that I'd say is essential to bring would be gloves. So even though here they often do have gloves available, the issue is that here, while I was here, you very often there were stretches of sort of days where you would just not find any large gloves, and all you would find are surgical gloves, which is sort of a strange situation where you can only find surgical gloves, not non-sterile gloves. But that's often the situation you find yourself in here, and so if you don't want to be wasting those resources using surgical gloves, then I recommend bringing your own. And also just good to have them, because there was one weekend when I was here which was known as No Glove Sunday, because they ran out of all gloves, and I think that's a situation you definitely don't want to be in. Third thing I say is essential to bring a pair of scissors, and I say this not because obviously you don't use them for sterile procedures such as suturing, but you need scissors for everything, because just cutting like what's this thing called opsite, which is the sort of all-purpose adhesive they use here for sticking anything, such as bandages or cannulas in place. So having a pair of scissors is pretty useful here. Then I'll move on to what I'd say are optional things. And so these are things that are nice to have, but you don't have to have them. And I think the first thing on the top of my list would be a head torch. And I say this because you often do a lot of your suturing in the pit, and in the pit the lighting's really like quite bad when you're suturing. And so obviously, to be extra safe, and so especially when you're using the aforementioned 6.0 suture, to be extra safe, having a head torch is really useful, so you can really visualize what you're doing and keep a good eye on all of your sharps. The second thing I'd say is optional but good to have would be a pen torch. Obviously now we use our phones a lot with the torches on them, but a pen torch is always good because you won't find them here at all. And then the third thing to say, which is optional but good to have, would be tape, because they don't really have any of the tape that we're used to in the UK. They use that thing I talked about earlier called opsite a lot. But opsite you'll find very fiddly and is not as good as just your standard tape. So if you really feel obliged, bring tape. And then the last sort of optional thing I'd say would be to bring a small bottle of like alcohol gel to wash your hands, because what you'll find here is that you don't wash your hands nearly as much as you do back in the UK, because there's not that much sort of like alcohol gel on the walls, and then when you go to a sink, very often the hand like soap has run out, and so you'll find that you're not really washing your hands much at all, and so you tend to feel quite grubby after a while, and it's amazing how quickly you become lazy and don't wash your hands. So I'd recommend bringing like a small bottle of alcohol gel or hand sanitizer, and bring a bigger bottle to refill and decant into it. So I'd say those are the essential and optional things to bring, and it's mainly based on like what you'll find you need here. So anyways, I hope this video was useful. I hope it was interesting, and I'm trying to churn out these videos a bit quicker now that I'm back home. So hopefully I'll finish this series shortly.